Welcome to the MedCoShare podcast, the podcast where we learn everything about what it's like to be a private practice healthcare practitioner in today's world. We dig deep into the challenges of being a healthcare practitioner, but also the rewarding aspects that the work entails. My name is Ronak Vyas, and I'm the CEO and co-founder of MedCoShare. Dr. Ryan Gannon and Dr. Matt Kavalak are the founders of Blue Ocean Health, a direct primary care practice based in MedCoShare's King of Prussia location. Today we have Dr. Gannon with us. Thanks so much for joining us today, and tell us a little bit about your background.
Thanks for having me here. Where to start? Grew up in Connecticut. That's where I'm from originally, and I became interested in medicine. I played soccer from a young age. My dad forced me to when I was younger. Hated it, grew to love it, and that's because he's from Ireland. And I think my interest in medicine really stemmed from trying to figure out where I could gain any competitive advantage from a young age. Mm-hmm. And ultimately, I did some research and work with genetics in college. I ended up going to St. Michael's College right in Vermont, and really loved the theory and the knowledge of the actual genetics and the science component of it, but absolutely hated the day-to-day pipetting and troubleshooting experiments. And ultimately, when I really considered my options and my interests, I thought medicine would be a really good mix of combining the science with working with people, and I like to think I'm a people person, and I thrive off of that type of energy and interaction. Ultimately came to medicine, and I guess we can talk about a little bit about Blue Ocean Health and how direct primary care came to be, but that ended up coming a little later.
Yeah, how'd you meet Dr. Kavalak?
Yeah, so Dr. Kavalak, my current business partner, we were randomly roomed together in medical school.
Okay.
So we like to joke that was the one thing our medical school did right. We went to New York Medical College. That was a great experience, and I'm just joking about that. But somehow, way, shape, or form, we both filled out some questionnaires, and they roomed us together based off of that. And found out pretty quickly we both had really similar interests, mainly being nutrition, weightlifting. We both had a fairly strong background in that, and then we were roommates ever since then, and ended up doing med school together, and then ultimately ended up both attending Chestnut Hill Family Medicine for our residency program.
Nice, yeah, and this is an audio medium, so listeners can't see you right now, but basically you and Dr. Kavalak are like amateur bodybuilders, is what I would like to say.
Yeah, the whole medicine thing's just a cover up. We're both trying to make it in bodybuilding. We'll see how that goes.
And you mentioned when we were talking a couple of weeks ago that you also, was it with Dr. Atia that you worked with before, or there was somebody in longevity medicine that you had like a stint with?
No, that'd be great. I'd love to speak and work with Dr. Atia at some point. We had spent a summer working with Andy Galpin, Dr. Andy Galpin,
okay,
out of Cal State Fullerton, and he that's kind of an interesting story in of itself. That was at the end of our first year, and then both Dr. Kavalak and myself quickly realized going through med school it wasn't exactly what we thought it would be. And I'm, a lot of people know, and for those who don't, in medical school, the amount that you get in terms of nutrition, training, the things that really interested us is absolutely minimal, if none. I think we had one class on nutrition, and that just really, that didn't make sense to me because I always viewed that as the foundation of health, or, and at least an absolute pillar of it. We end up finding Andy Galpin, I think, mainly through searching online. He was really gracious to have us out there for a summer and expose us to a lot of the research he was doing with, world-class athletes. He's one of the country's leading researchers in terms of muscle biopsies, and since then he's absolutely expanded and really just trying to push high-quality information out towards athletes as well as individuals, how to better improve their lives. But that really helped to expand on, our views of what health encompasses as a whole, and what would that look like if we continue down this path of medicine, which we were sure, still a little bit unsure at the time. Mm-hmm. But he really helped to shape our views.
Nice. That must have been an amazing experience. Mm-hmm. So just shifting back to what you're doing now, you run a direct primary care practice. How is that different than a traditional primary care model?
Yeah, a few ways to explain it. I like to think that you get the best of a primary care experience without the headaches, both from the patient and the provider perspective. And the other thing I typically tell patients is, if you think of primary care in terms of a spectrum, on one end, if you had concierge medicine, sort of like an on-demand type of medical care that if anything's going wrong, you can contact instantaneously, someone's going to get back to you, versus the other end, purely within the system, you may be stuck waiting for several weeks for an appointment. If you call, you might be waiting half an hour, 45 minutes, maybe an hour longer to get a return call. You're rarely ever getting hold of the doctor. Direct primary care is a really unique and good solution. I think it really balances the best of both those worlds. So it's a direct relationship between the provider and the patient. As an example, with Dr. Kavalak and I, we don't have any other staff members that work with us, so patients directly have our number. If they have an issue, they text or call. We get them in quickly, within a day, certainly within a couple of days or the week, depending on their schedule, if something concerning is going on. And the main benefit of direct primary care from a provider's perspective, from our perspective, is that it truly gives us the time to sit down and get to know someone. So I don't care, you could be the best doctor in the world, but if you're, part of a traditional practice, a sick visit may be anywhere from 5, 10, maybe 15 minutes is pretty gracious. You're getting up there. But there's only so much you can do, and my biggest fear would be that's where mistakes happen, and it's just not quality care.
Yeah.
So it's a great model that it really affords us the time to actually sit down, get to know our patients, and it's just an entirely different experience when it's a comfortable environment, things aren't rushed, and you really get to know someone, which makes a world of a difference.
Yeah, I would say one of the issues that I deal with is if there's a long wait time with my primary care, I end up just going to urgent care nearby, and the problem with that is you're going to usually get a different doc or a PA every single time. So they don't really know you. They don't know your history. They are just basically trying to take care of the symptoms that you're telling them, and that's it.
100%. And I have so many thoughts on that. I think where medicine is at, mainly primary care in the country right now, is that everything is so fractionated, and there's just too many hands in the pot. So for the majority of things, that should really be handled by a PCP who knows the history of the patient, any particular medical conditions, what's worked in the past for certain symptoms, if they're new, if they're recurrent. And urgent cares absolutely have value. If they didn't, they wouldn't be here. But they arose because we lost that connection between the PCP and the patient. And I think, a big part of what we're trying to do is restore that trust. I think there's a pretty big distrust with medicine as a whole, but especially primary care. And ultimately, it's just become so fractionated. It's one of the major issues we're trying to address.
Yeah, no, absolutely. A critic would say that a concierge model is basically, doctors for rich people. And then I kind of looked into the pricing and found out that's really not true. So what do you say to people that are more critical of doing something that's more concierge care versus the traditional healthcare model?
I think first and foremost, people always have autonomy, and I like that in a market, whether it's medicine or anything else, there's always options. So for those who choose to utilize their insurance for primary care, more power to them. I think that's great. I think for the individuals who are looking for a bit more attentive care, someone who has the time to really get to know them, is responsive in a very timely manner, and has from what I've seen, or there's a saying that once you've seen one direct primary care practice, you've seen one direct primary care practice, because it's truly reflective of the individual, their personality, their particular interests as a person, their areas of medicine. But it really has been shown to improve health outcomes, number one, and which is first and foremost the most important thing. But number two, patients don't have to break the bank or, in my opinion, be concerned from a financial perspective, being how affordable the rates tend to be. As an example, for, most direct primary care practices tend to structure their pricing based on an age tier, with the idea that medical complexity increases with age. And just as one example, for patients who are 20 to 44 years old, that's $50 per month with us.
Okay.
And that covers all aspects of care, including the communication, whether that's through texting, calls, emails, video visits, as well as in-person office visits. So there's no additional co-pays, there's no additional service fees. We could talk about like ancillary services at some point. That is an additional fee, but that it's also very affordable. So ultimately, depending on the person, it may not be a good fit from a financial perspective, but we really cater and market towards, I certainly wouldn't say it's the affluent. I would say it's meant to be for the average person and the average family. And it's really hard to even describe our patient demographics. We have individuals who are having a really, really tough time but choose to have their care with us. We have individuals who are really affluent and choose to see either Dr. Kavalek or myself over a concierge practice. It's a little bit all over the road, but ultimately it's sort of an experience that you kind of only get to understand and grasp it and feel it once you've done it.
So what's your pricing after the age of 44? And the reason why I ask is I'm 44 now. I'm turning 45.
Yep.
So I want to lock in this price before my birthday.
Yeah, so 20 to 44 is $50 per month. 45 to 63 is $75 per month. And then 64 and over is $100 per month.
Okay, so still not too big of a jump. I think that's very affordable. So let's talk about like access to care. You mentioned that you and Dr. Kavalek are available by phone, by texting. Is it 24/7? Is it 9 to 5? Like, what are your hours like? What's the process like?
In one sense, we're truly on call all the time, which is why some docs have a hard time. Maybe they're interested, but they don't necessarily want to switch to direct primary care because of that. I often get either texts. It's mainly text. Most of our patients really like texting. Sometimes I'll get some late night texts. I'll typically respond. I don't consider it a bother or anything. Our etiquette is that we'll always get back to you within 24 hours. Having said that, we're always back within a few hours. If it's an absolute emergency, it's always 911. If someone's calling me late at night, I'm going to pick up, God forbid there's something that they're concerned about there. Hey, should I go to the emergency room for this particular issue? I'm concerned. And I think it's just huge to have some guidance. Everything's okay right now. I'll see you tomorrow, or, nothing to be concerned about from that perspective. If someone's calling me and it's, 10:30, 11 p.m. at night because they need their medication refilled for next week, maybe that's a discussion, and just in terms of the etiquette.
Yeah.
And there's always a little bit of education with that, but having said that, I'm more than happy to answer most texts depending on how late it is, if I'm sleeping or whatnot. So
do you guys have to alternate your vacation days? Because I can't imagine both of you going away at the same time.
Yeah, well, the beauty is, with two of us, we always have a doc, covering the practice.
Right.
So that's what we've done in the past. Having said that, as you continue to care for someone and you really get to know them, when someone with one of my patients is texting or calling me, I have a very good understanding of what's going on. So a lot of the times we'll actually still, take texts or calls because it's, truly not a bother. I had a family vacation in Ireland this last December, and in that circumstance, Dr. Cadillac did cover for me.
That's that's good that you have another partner where you guys can rotate. So what services are included in the DPC membership?
So you can think of everything that you would get in a traditional primary care setting as both family medicine trained physicians were going to offer. So that ranges anything from caring for chronic disease management, most commonly being high blood pressure, diabetes, asthma, high cholesterol, etc., as well as acute concerns if someone had a particular injury, if a particular concerning lab work came back and we need to work something up or do further testing. Based on both our interests and personalities, we also work with individuals regarding their nutrition and exercise. Another big component is hormonal replacement therapy for us, for both men and women. So that's something that we both do. So pretty much that everything that you get in a primary care setting,
right,
plus our additional interests.
Yeah, and I actually have a family member that has joined you guys. So I know a little bit about the preventive care that you guys are doing, and I was saying it's pretty amazing. And like once you reach, I think it's pertinent in any age, but like once you reach 40 and above, it's more about prevention and try to optimize your life and your health versus just taking care of illnesses, right? And typically right now they recommend you do your annual. Do you guys go above and beyond that? Or what do you recommend to your patients for preventive care?
Oh, man. It always depends on the particular individual and their underlying conditions. So the way I think about it is I always meet someone where they're at. This kind of touches on something that I think is also a bigger issue in medicine purely because of the lack of time, but for a lot of things, it's not necessarily a knowledge issue. It's I almost think of my role as more as an advisor as well as an accountability partner rather than a doc. As an example, for a lot of my patients to help gain awareness into their overall eating patterns and habits, I'll have them do a food log where anytime they put something in their mouth, liquids, food, they're writing that down for 2 weeks, and then they're sending that to me so we can fully review, because a lot of times it's just an awareness thing that people, we're going through the motions, but we don't necessarily know our habits and what we're doing.
Yeah.
And I think that behavioral aspect is a huge underlying part of a lot of what ends up being chronic conditions. And that's the basis of how I think about it. And then, of course, once someone does have high blood pressure, diabetes, or what have you, we're going to address that. And that still speaks to the fact that, again, it depends on the individual. I have a lot of patients who are turned away from various primary care practices or their prior PCP because they wanted an alternative solution and didn't necessarily want to go on medications right away. And again, my view is that the autonomy always comes first, is that individual decision. I'm more than happy to, there are great supplements, for example, or lifestyle factors, especially for diabetes and high blood pressure.
Yeah, I think accountability is a big thing. And the Hawthorne effect, where you behave better if you're being observed, or you think you're being observed. I think that's something that I need, right? Because when there's no accountability, you just feel like doing whatever, whenever. Especially for me, like if it's a long, stressful day where I've been on the road for a couple hours and fighting that traffic on 95. The last thing I want to do is go home and work out and eat a salad, right?
100%, yep.
So, you talked about like chronic disease management. So can you tell me a little bit more about how you deal with heavily diabetic patients or, high risk patients with heart disease?
Sure. So for one impression I certainly don't want to give is that sometimes, we have people seek us out because they're under the impression that as direct primary care providers, we're outside of traditional medicine. And I like to think, again, that we combine the best of all worlds. So my job is to continually keep up on my knowledge base, but that encompasses both medicine but also other fields outside of medicine. And I think the best example, what I try to do for a lot of my individuals with diabetes that I care for, is diabetes in the traditional primary care setting is often purely just treated based off the blood sugars. We often throw insulin at individuals with the idea that we're trying to improve our numbers, right? Our lab work. So our hemoglobin A1C, which is the reflection of the sugars over the past 3 months, as well as when our patients are checking their sugars throughout the day. The problem is that we've known for a pretty good length of time that if we reduce someone's sugars, we'll improve their microvascular complications, meaning the disease associated with the eye, associated with the kidney, but will worsen macrovascular or big vessel complications, so strokes, heart attacks, and the reason is because of too much insulin. So on one hand, what we found over the past 50 years that we've treated diabetes, we've improved all the problems associated with high blood sugar, but we've worsened, or we certainly haven't improved, the issues associated with high insulin. So the main issue is you got to get sugar out of the body. And there's a particular diet method called the Bernstein method. So this was a doc. I think he's in Long Island. I could be wrong, but I believe he's in New York. And he developed a particular pattern of eating where even with individuals with type 1 diabetes, who they don't produce any insulin, their bodies aren't capable of that, he'll have them get down to only a few units of insulin per day, which is unheard of, as well as when you look at their blood work, their markers, so their A1C may be normal, so they don't have diabetes based on their blood work,
right?
But they still, for all intents and purposes, or they have it, or they're really high risk of coming back up. And I think it's such an amazing thing to see, to have individuals with type 1 diabetes with that tightly controlled blood sugars is unheard of, even almost on insulin. But it goes to show you the power of behavioral modifications and using what we're able to do with our own bodies. And part of that program is a lot of exercise. So I'm not going to lie, it's difficult. And one of the things that they do is a lot of aerobic activity, which your body is able to take the blood sugar the sugar in the blood and put it into the muscle, which is where a majority of the blood sugar is stored. So these individuals may do, an hour or two of some form of cardio per day.
Okay.
But the ability, our bodies are this amazing reservoir, and a lot of what we do in medicine is to mimic the effects of exercise. That's what we try to do with a lot of medications. But I think as a whole, the Bernstein method is a great tool at our disposal that if I didn't have the time with someone or the ability to even look this up or look for alternative methods and educate myself, there's zero chance I'd be able to do that in the traditional setting.
Right.
And there's certainly, examples for high blood pressure. I have patients through a combination of exercise, sauna, various supplements like taurine, garlic, cocoa powder is a great example. No antihypertensive medications were able to get them to normal blood pressure.
Oh, wow. And I think this is the real benefit of becoming a member, right? Like you wouldn't get this advice in a traditional primary care office. So the nutrition aspect to it, the preventive care aspect to it, it's really not there because if the docs are only spending, let's say, 10 minutes with the patient, there just isn't time to get into all these things, right?
Yeah, and that's, speaking more to that, I think not the majority, but a significant percentage of referrals purely happen due to lack of time. So, Dr. Kavalak and I, we both started our practice directly out of residency. But in our training, if you had an individual who, if you're supposed to see 15, 20 people per day, which is, that's a light, patient load for the day. And if you have someone who comes in and they have 3 or 4, chronic medical conditions and concerns, and you're rushing as fast as you can because your first patient showed up late, and there's something acute or worrisome going on with a different patient. And then as you're heading out the door and they say, well, what are we going to do with my knee pain, which you didn't talk about? You purely don't have the time. You're going to write a referral to the orthopedic doctor. And I think the incentives they're aligned differently. So the incentive in direct primary care is, I think, to really do the best by the patient. I think the patient also has a little bit of buy-in, kind of metaphorically, but there's some skin in the game. Whereas in residency, if I had a really busy day, a lot of times I was hoping patients wouldn't come in. And I knew purely based off of that, if I were in medicine, I wouldn't be able to practice in that type of setup.
Right. So what do you think is the future of DPC?
I think it's going to explode. To my knowledge, when we had started, so we've been open about 2 years now, I think we were the 4th practice in Pennsylvania. I think the last time I looked, there was just under 2,000 practices like this in the country. It's much more popular in rural areas. It tends to work really well. But now we're also seeing it being incorporated into more suburban areas, more cities. And I think it's just the perfect, storm and combination of insurance is getting tougher. I think people as a whole are looking for alternative solutions, as well as just alternative models of care and someone to be a bit more invested in their health.
Right.
And I think all these, things are coming together, that this will be one of the main ways that primary care is practiced.
Yeah. I mean, that's pretty incredible that you guys were number 4 in the state.
Yeah.
What advice would you give to docs that want to start their own DPC?
You just got to do it. Yeah. Sometimes I think I could give all the advice in the world, and I think I tend to be a little bit of an overthinker and a little too much introspection. At the end of the day, you got to pull the trigger. The beauty is there's so many examples of those who have laid the groundwork, and at this point, it's just a matter of checking off the boxes and just following the checklist. You went to medical school, you did your residency training, you've done things that are incredibly hard. You can certainly start your own business. Nice.
Did you have any issues with marketing or educating patients as to this model?
Yeah, 100%. I would say that's probably still our biggest hurdle.
Yeah.
And we're always willing to do, the first month of care is on us. Because again, like I said, it doesn't click until someone's, been in the chair with us and they've had the time to explain what's worrying them. They're not immediately rushed out of the office. And then when they leave and, I text or I call them, we're following up next week about their blood work. And then they have the, aha moment, and,
right.
and it solidifies everything in their mind.
Yeah. And is it just, directly to patients, or do you work with companies as well?
Yeah. Yep. So those are our 2 biggest demographics. So we provide both primary care services for individuals and families, as well as we work with companies. So our goal is to both improve the health of the employees. I'm a really firm believer that healthier employers are likely happier employees. They're
right.
probably more productive as well.
Yeah.
And there's a lot of unique ways to incorporate this within companies. We work with one particular company who pays for the memberships of all their individual employees, and they get the same level of care and access to us as our regular patients.
Okay.
There's other individuals that we know as well who can work from the health benefits end. That tends to be the most confusing part about it.
Right.
But to try to reduce the cost to the employer from that aspect while having a really good service that their employees love.
Yeah.
So we do both.
Yeah. Now this is Dr. Yan. This was amazing. Where can patients find you?
Yeah. We have, we're both on social media at Blue Ocean Health DPC, as well as our website, www.blueoceanhealthdpc.com.
Perfect. Thanks for coming on.
Yeah, thanks for having me.
MedCoShare provides turnkey medical office space for health and wellness providers. Our memberships are month to month, and providers can rent one or multiple rooms based on their needs. We also have an in-house staffing and marketing team to help you grow your practice. To learn more, please visit MedCoShare.com or stop by one of our locations and get started today. If you want to hear more of these conversations as we dig deeper into the lives of our members, please follow us on Spotify, Apple Music, or wherever you get your podcasts. Follow us on social media to hear more from our doctors and nurses, as well as to keep updated on all things MedCoShare. We hope you'll join us on the next one, and until then, don't forget to practice your way.